Institutional response to COVID-19 made it possible for the country to maintain very low cases and deaths per million population. That was the assertion of Union Health Minister Dr Harsh Vardhan at a virtual meeting of the Regional Director of WHO for Southeast Asia with Ministers of Health of the member nations. On the efficacy of the lockdown in India in curbing the spread of COVID-19, he explained that it was effective in slowing down the rate of growth of cases and gave the government time to augment health infrastructure and testing facilities.
Union Health Minister Dr Harsh Vardhan outlined India's tryst with COVID-19 while addressing a virtual meeting of the Regional Director of WHO for Southeast Asia with Ministers for Health of the member states of the region. The meet was focused on maintaining essential health services and public health programs in the context of the COVID-19 pandemic. Dr. Harsh Vardhan highlighted how India had been preparing for the pandemic as soon as China informed WHO on 7th January. Earlier viral outbreaks like the avian influenza, H1N1 influenza, Zika and Nipah saw the evolution of containment and management strategies that use whole-of-government approach. India divided its facilities into COVID and non-COVID facilities. This helped in better management of patients, ensuring effective treatment of hospitalized cases. India's proactive and graded multi-level institutional response to COVID made it possible to have very low cases per million and deaths per million as compared to other developed countries.
Continuous decrease in the share of active cases and a rise in the recovery cases. You can see that right now the recovered cases are almost double the number of active cases. This is I think because of the concerted efforts on the field, which has translated into these higher recovery rates. Every day the recovery rate is much better than the earlier day.
Dr. Harsh Vardhan said that the lockdown provided an opportunity to expand testing, treatment and quarantine infrastructure.
Testing capacity has been augmented to a total of 1,366 laboratories, which are conducting more than 600,000 COVID tests daily in the country right now. And it would be pertinent to mention that we have started our journey from one lab in the country, and right now we are at 1,366 laboratories all across the country.
He also highlighted how India leveraged technology to provide essential medical services during COVID-19. A first of its kind web-based national teleconsultation service online OPD service in the world has completed 71,865 consultations so far completed. Mobile apps such as Arogya Setu and Itihas have aided in checking the spread of infection without obstructing medical care. Meanwhile, the government has released Rs 890.32 crore as the second installment of the COVID-19 emergency response and health system preparedness package. 22 states and union territories will receive aid under this package based on caseload. This installment of the package will be used for strengthening of public health facilities and infrastructure for testing. The first installment of Rs 3,000 crore was released in April 2020 to all states and UTs. Dr. Harsh Vardhan shared India's experience in prioritizing availability of essential health services while simultaneously managing the COVID-19 pandemic. News 9 Desk, DD India.